Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Memorial Hospital. We know all about the Memorial Hospital. They have the greatest hospitals in Broward, South Broward. And one thing they have that's unique, and I have been so impressed with it, is the Wound Care Center. It's really called Wound Healing and Hyperbaric Oxygen Therapy. I have been an admirer of hyperbaric oxygen for a long, long time. And thank goodness Tina Marino, who is an RN and a certified wound care person. She's a program manager, and it takes a lot, though, to manage a program that important and that big. And we have a guest that she brought, CESAR Solis, who's a paramedic, and lead hyperbaric safety tech. So I'm getting so excited about having you on, CESAR, because I have so many questions to ask you after I talk to Tina. In other words, you're a paramedic in addition to being a hyperbaric safety tech, but don't answer. I'll ask you in a minute. It's wonderful. You just have all these credentials. Okay, let's get back to Tina. You know, Tina, we're going to see Memorial Hospital. They're one of our major sponsors at Boomer Expo and have been for many, many years, and my hat goes off to them. And if you haven't been there before, when you walk in and you see Memorial, you see, I don't know how many people they bring. It must be not 100, but, it seems like a lot. They're taking blood tests. They're taking this. They're taking that. They're terrific, and they have the smiles on your face, and they line up. People line up for Memorial Hospital. So we always put them on our YouTube. We put them on our Facebook. They're really a great organization. So now you, though, have a special feature with them. How did you get involved as an RN? You could have been anything. Why did you get into wound care?
Well, I started, I've been with the system on and off since 94, and I moved to different areas, and I was working in home health, and there really was a need in home health for people to manage their wounds. So through working with home health, I started referring patients to the wound center. And through the years, I made a few career moves, and I wound up in the north end of the state, left Memorial, and was a case manager for wound care in the north end of the state, and then came home, if you would, back to Memorial, and was actually recruited to see if I would run the wound center. And it was a very exciting opportunity, and we really had a lot of growth in the past year.
Yeah, it's a very important responsibility, and I am amazed, Tina, how many people do not know about it, including doctors, and they are treating wounds without using the hyperbaric oxygen, and these people suffer, and I don't know what we can do. I want to shout from the tops of buildings. They're so stupid not to do that. What's our problem?
You're exactly right. It's exposure, and that's what my job has been, to bring the exposure and let people know and really empower patients that they have this option available to them. And, a lot of insurance companies are behind hyperbaric oxygen, especially Medicare. So we want to let them know that this service is available to them, and enlighten the physicians that this service is available, because many times physicians just don't know. My experience in home health was that the primary care physicians weren't used to treating wounds. They didn't go to the seminars. They didn't know the new products that were available, all the state-of-the-art treatments such as hyperbarics. So my job is to get out there and to let them know.
Well, before I talk to CESAR, I'll just tell you personally, my mother, who lived to be 94, probably had an ulcer. She had a decubus,
a pressure ulcer, yes.
A pressure wound, and she had that from sitting too much.
Right.
And even though she had a home health agent, a home health aide was there, none of us realized what was happening. So now she has this mild form, and before you knew it, it got much worse. No one said that she should go to hyperbaric oxygen. It took a year of constant care to get this cured. Now, that's horrible. So now I see here CESAR Solis, who is shaking his head, and you are a tech for this. You understand it so well. How did you get involved in this?
Well, I was working in the ER, and I met a doctor that worked at a hyperbaric facility. He brought me in, and I started getting training by my coworkers at the hyperbaric facility that I worked at. And through them and just going to school, going to those hyperbaric classes, I started learning what hyperbaric medicine was and treating different types of patients. I got the knowledge with these patients that I would see.
Weren't you amazed at what?
I was very amazed. I mostly with traumas and the wounds that hyperbarics can treat and do better without with surgery. Sometimes with hyperbaric itself, it will help the wound.
Are you finding many military persons coming to you?
No, not military persons. Just we don't see those type of wounds here, but car accidents, motorcycle accidents, depending the facility, that's what we treat.
You know, I'd like to add, we also like to be known, it's not in our title, as a limb salvage center.
Correct.
So patients who have had diabetic wounds that are not healing, that are facing amputation, we have such results, and CESAR will speak to that, but it's 95% of wounds are healing that these patients would typically be facing an amputation.
Tina, that's amazing information. And so when they come in and they're scared to death, I'm sure, because they know what's been told to them, about how many treatments would they require if they've had a very serious wound, CESAR?
Maybe 40 treatments, and they have to be very consecutive with the treatments due to the protocol of hyperbarics.
Do you know that plastic surgeons now have in their office a mini? It's not the big oxygen, the tank. I mean, the big, what do you call it, where the hyperbaric oxygen, what do you call that thing that people go in? What do you call it?
It's the tank.
You call it a tank? I'm not sure.
Yes,
Okay, it's a tank. They have a little thing on the side that when someone has plastic surgery, that they put they get them, there's like a little plastic thing goes over their head, when they give them oxygen.
It's not the same, though.
No, I know that,
yes.
but just the idea that they recognize that oxygen is healing.
it will help. Yes, that is correct.
It helps to heal.
No,
yours is much more serious, but I'm just laughing at that because here they have this because they know it's very helpful. Many, many years ago, when I started in this field as a gerontologist, it must have been 30, 35 years ago, I went to a seminar, and they were raving. The doctors flew in from someplace, New York or California, with this salve, which was unique, which was going to take care of anybody that had deep wounds. And they showed all these pictures. They never talked about hyperbaric oxygen at that time. And I was thinking about that the other day. They sent us home with some samples in case you needed it. But hyperbaric oxygen is a different kind of a field. It's a very high tech.
It's very specialized. It's been around for so many years. It's just people haven't been educated well enough to know what hyperbaric medicine is or does. It's unfortunate because, it could really help patients that really need hyperbaric medicine.
And how many tanks, we'll call it tanks, how many do you have there?
We have 3. We have 3 monoplace chambers. They're
It's a
single-person
chamber.
chambers.
That was the word I was looking,
Yes.
not a tank, but a chamber.
Chamber.
The chamber. So you have 3.
We have 3 of them.
So that's good because now how long does it as a treatment typically take?
Anywhere from 90 minutes to 120 minutes, depending on the protocol for that patient. The 90-minute patients, those are for wounds. The patients that get anywhere from 120 to 130 minutes are radiated patients because we treat radiation injuries.
What is that? What is
Radiation
that like?
injuries are patients that usually have radiation. They have cancer. They get radiation to the prostate, radiation to their ovaries, and sometimes the radiation will burn you from the inside out. So these patients will have trouble sometimes going to the bathroom. They'll be bleeding. So what hyperbarics does is bring down the swelling and help with the inflammation of that site.
Wow.
Yeah.
That's exciting. Tina, you have to help us get some of your physicians and all to start writing articles in our magazine about this. This is ridiculous that here we are in South Florida with your kind of expertise and your kind of a center, and we're here in a radio show with people listening with their mouths open saying, oh my gosh, I had this, I had that, no one told me about this.
You're exactly right.
I mean,
another area, because the research is developed every day. There's all new things, new protocols. Another area where hyperbarics is very successful is for flap grafts. Let's say if you had breast surgery and you have a flap and that flap is failing because there's not enough oxygen getting to it. We're radiating patients before the surgery to make sure the surgery is going to be successful. And then we continue that hyperbaric after the surgery to make sure that grafted skin gets all the oxygen. And Caesar can speak to how actually the oxygenation works.
Yes. The thing is, we increase the millimeters of mercury inside the body. Usually here at atmosphere, it's very low. But once we induce them to a higher pressure, we treat anywhere from 2 atmospheres to 2.5 atmospheres. So with that increase of oxygen, it starts the healing process. You create new vessels. You hyperoxygenate your vascular area, where it promotes that healing process and that new granulated tissue, that new tissue growth where that ischemic area is located.
And you can prove all this because you take it before, right?
I've seen it. They take pictures of before and after, and it's very mind-blowing of what hyperbaric medicine does for the patient. And it's a really big benefit for the patient.
I'm pulling from somewhere in my brain, but it seemed to me that I read an article that astronauts were given hyperbaric oxygen when they came back or something, that there was something that some scientists, and it helped them
They
recover.
kind of have to, what is called is decompression. With astronauts, they're getting not hyperbarics, but hypobarics. They're going up in the atmosphere. When hyperbarics, you go down in the atmosphere. So there's a difference between hyperbarics and hypobarics. You build up nitrogen in your body. That's where decompression sickness comes to play. It's patients breathing compressed air for a certain period of time where they breathe nitrogen, and that nitrogen is an inert gas that cannot live in your vascular area. So you have to breathe oxygen to diminish that nitrogen. That's what happens to astronauts when they go up. They have to breathe oxygen to diminish that nitrogen. If not, they can have decompression sickness.
Yeah, it's very tricky, and that's why it has to be done by a hospital. Anybody, listen, don't go casually to a hyperbaric center. You want to make sure it's done officially and with people who are really skilled and have credentials. And we're so lucky that Memorial Hospital took this under its wing. I think there may be one up in West Palm Beach. I think JFK may have hyperbaric oxygen, don't they? Somebody does.
I don't know if it's JFK, but I do want to speak to your point that there are centers that are opened by people, and they do what we call off-label dives. Those are dives that are not on the Medicare-approved guidelines. Some people believe there's some research about autism with hyperbarics or Alzheimer's. Or even some people like to go for cosmetic purposes, but we don't do those kind of dives. But there are privately owned salons, if you would, that have. But you want to go, like you said, to a center like Memorial's where we have hyperbaric certified physicians, hyperbaric certified technologists, and hyperbaric certified RNs that monitor you the whole time you're in the chamber.
And so Medicare will pay for this if you're there and you're a
Yes.
Medicare patient.
If you meet the Medicare guidelines, there are 15 diagnoses that meet this. But just for a broad net, and of course, if they called the center, we could help them with any certification or authorization needed. But the broader ones would be diabetic wounds, radiation injuries, pressure ulcers that are of a certain size, but we do all evals at the center. You're welcome to call the center and come in for a hyperbaric eval. And if not, if you don't meet the criteria for the eval, we could certainly do the wound care there.
Let me give a number. It's 954-883-8014. Again, remember, this is Pencil Talk Radio. So write this down, 954-883-8014. And one thing that you should read when you pick up Boomer Times, the July issue, is there's a whole article, very good article by Dr. Blaine Shatkin, who is actually a plastic surgeon, but he also is, I think he's the medical director of the Memorial Hospital Center for Wound Healing and Hyperbaric Oxygen Therapy. And the Memorial Hospital that we're talking about is down in Pembroke.
Right.
So
That's right.
They have a lot of them.
We're located on University and Sheridan Street in Hollywood.
Yeah. Now, what about ages? Would you take anyone in? I mean, are you doing children?
We don't do pediatrics as of yet. Any patients of the age of 18 or above are treated.
And what would happen for a child? Is there one that would take a child at this moment that you know of here?
I think those off-label hyperbaric
I see. Now, why? And that's strange. You're going to have to work on that.
Well,
Tina.
You're right. We do have Joe DiMaggio Children's Hospital that's in the Memorial System.
Do, but they
so
don't
we are
do it, huh?
there are talks in the work to develop a pediatric wound program that would include hyperbarics.
Yeah.
But at this time, it's still in the talking stages. But what I wanted to tell you about is that our center has just been renovated. And we have a real spa-like, luxurious feel to our hyperbaric area. So when our patients come in, they're treated to a private dressing area. Their caregivers or their relatives could come with them and wait in a private area with big screen TVs. We have a coffee bar. And when the patients go into the chamber, they have their own TV, their own big screen TV. We have a library of movies they could pick from while they're in there, or they could watch a movie that's on the TV already. And they are able to talk with the therapist, for the whole time they're in the chambers through an intercom phone.
So that they're not nervous.
We always have contact with the patients, yes.
Right.
Now, what does it feel like? Have you been in the
Yes,
chamber?
I've been in multiple hyperbaric
Tell
chambers.
us what, all of a sudden we're lying there, do we start to get,
No,
silly?
the only thing you
What
feel
happens?
is pressure in your ears. That's the only thing that you feel. Your voice may change if you go a little bit deeper, but it's no big thing. It's a little bit scary for patients that are not used to it, that are not accustomed to those things. So we coach the patient through it. The times that I've been I've been inside in a multi-place chamber, not a monoplace chamber. I don't
know what the difference is.
The difference is the size and the amount of patients that could be inside the chamber. I've also been inside a monoplace chamber, which is the one that we have at Memorial Hospital. It's an acrylic chamber that's 40 inches in diameter and 8 feet long. So it's a pretty big chamber that the patient could move around. We're always keeping constant communication with the patient, and we coach the patient through whatever issues they're having inside the chamber. Most of the patients just go to sleep, watch a movie, watch a show. Like Tina was saying, we have big screen TVs that they can see from the chamber. But the only real actual feeling that they're going to have is in their ears. It's in their middle ear.
Okay, so when they're finished and they come out, do they get something to eat? Or, is it like when
if they want.
No, what is it like when they come out? All of a sudden now they're not getting all that oxygen. What do they feel like?
Nothing, just, they feel this
Smarter,
sensation
happier?
in their ear. They're much happier.
They're
a little bit
smarter,
tired.
actually. Oh,
They're a little
tired.
bit tired. It's like if you're scuba diving, but without water, but they feel much better, they feel healthier.
I will tell you, their skin looks great.
Okay, so Tina, I want to make a date with you. I want to come.
Absolutely.
And I want to meet that. And I wonder, could I experience that? Would you? That's not right. You can't do that. So you can't do it as an experiment, can you?
You know what? We could talk to Dr. Shakin.
Yeah.
He's the medical director.
He won't let me do it then. He knows me. He knows I'm crazy.
Yeah.
Do you know, I would like to do that because I can be a better spokesperson for you if we did that, I think. I'm still going to be a great spokesperson.
We'll give you our gowns and...
You know, the majority of patients, I would say as high as like 98% of the patients, they go in, they go out, they come during their regular day, they stop in for the 2 hours and they walk out and they're on with their day. We've had young mothers who have just given birth and they come and...
Why are they there?
Sometimes they have
diabetic wounds
that won't heal, C-sections, breast flaps, all
C-sections,
kind of things.
they can come to help heal the C-section?
Well, they have to meet the Medicare guidelines.
Right. So maybe they're
it has to be a non-healing wound
right?
of a certain depth. Right, exactly. But we have all types of people that come in and come out. Some come on stretchers, some walk in. It's really a variety of patients.
And so, how old is the oldest person you've ever had been in a chamber?
Myself, 93 years old, has been the oldest.
93, and they do fine. In fact, they do
Fine.
better,
They do
don't
great.
they?
They do fine.
They
They
Yes.
probably add
Yeah,
years to
they're-
their life.
It's the young ones that are more scared than the older ones.
And you know,
But
if
no,
some people do experience where they have some anxiety, our medical director will, there are some medications that they could get
Sure,
if they feel that.
relax.
But the majority of the patients
Yes.
really don't need it. It's a beautiful room. It's low lit. We have the TVs on. You really don't feel anything. They go in there with a bottle of water and a blanket, and before you know it, they're usually asleep.
Yeah.
It's probably the best nap going.
Well, geez, Caesar, you're in an unusual profession, aren't you? When people
Yes,
say to you,
yes.
when
I'm
they say
happy
to
I
you-
am in this
Right,
profession.
right.
I
You
enjoy
are,
it. I've
aren't you?
learned so much. I've been doing this for 10 years, in hyperbaric medicine for 10 years. And in those 10 years, I've learned so much. And I love what I do.
So, how do you explain to someone who asks you what you do?
Oh
how
my
do you
God.
explain
that's,
it?
That's an explanation that they just look at me and they're like,
Yeah, right.
What is
Come on,
that?
give us-
Do you
give
go
it to us."
under? And
Right.
I'm like, no, you don't go under. It's pressurized with oxygen, and it simulates. It simulates like if you're scuba diving, but without the water. That's the explanation I give them for hyperbarics, and then I break down the type of wounds that we treat and how we treat them and what type of patients we treat. And they're surprised because they didn't even know.
Of
Some
course.
people are not educated where they know that this type of treatment exists. And that's the sad part, that some patients do need it, and Memorial will help them out with that.
Yeah, that's true. What you just said. So it's really a case of getting the word out. Otherwise, these when people are in there, do they actually see? You said it took 20. Sometimes I forget how many times you said it might take to cure a wound, but no one goes in there and they walk out and it's cured like we see on television. This,
No,
you know,
it
Batman
takes
and
a
Robin.
numerous amount of treatments for them to see some new tissue growing on the
Oh, that's
wound.
what it is. So they
So it
actually
could take
see.
anywhere from 10 to 20 treatments till they see a change. But they start feeling better once they see their wound getting better also.
Because the fear is if they didn't have this, they could have an amputation.
Correct.
Exactly. Well, the treatments take place in a short amount of time. They have to come Monday through Friday, so it's once.
Every
it's
day?
once
Oh, I
a
didn't know. We
day.
didn't talk
It's
about that.
Monday through Friday for
Oh.
8 consecutive weeks.
Correct. You have to be very consistent.
Yeah. So once you earn that spot on the schedule, you keep that spot for the next 40 days, Monday through Friday. So in about 8 weeks.
Correct.
Really? So that's what it takes to be for the oxygen really to keep working. Otherwise, if it isn't that consistent, then maybe it
Right.
goes back the other way. Huh?
Yeah, we wouldn't want them to miss so many days. We always advise our patients, and we tell them before they even start, please make a schedule to schedule hyperbaric medicine in, because it's going to really help you out. So
And
they
you
need
know-
to, as much as we work with them, they work with us.
Of course.
And I always will work with one of my patients to schedule them at the time that they could come.
Of course. Okay, my guests are Tina Marino, who is an RN and who is a wound care certified person. She's the program manager, and we're talking with CESAR Solis, who's the paramedic and lead hyperbaric safety tech at the Wound Healing Center and Hyperbaric Oxygen Therapy Unit. And it's at Memorial Hospital, Pembroke. Yay! And you were saying that, Tina, that you've had a whole new restoration, renovation. Why is that?
Well, we just needed to dress up the place
I mean,
and
it's-
give the patients what they
How
deserve.
old is the center there?
The center's been there about 11 years.
Oh, really?
Right. And what else I wanted to mention was we have a panel of physicians. So depending on what type of wound the patient calls with, we line them up with the perfect doctor for them. So we have plastic surgeons, we have general surgeons, we have podiatrists, we have internists, we even have emergency medical physicians that see patients that work different days. So when the patient calls, for example, a burn, we'd line up that patient to see the plastic surgeon. If it was an abdominal incision that wasn't healing, we'd have that patient be followed by the general surgeon. If it was a wound on the leg or feet, we line up that patient to see one of our podiatrists. And we do have podiatrists and surgeons, and our plastic surgeon are all hyperbaric certified.
And so people literally walk in there without having been referred?
Well, we will take walk-ins. That's for
No,
certain.
but that's what I was saying when you said that you'll get a doctor for them. I mean,
Correct.
they didn't have a doctor?
We've had patients that call us that, they have a wound. They found this out through the internet, and they give us a call, and we explain to them what they could do. One thing that I'm very happy about working at Memorial Hospital Pembroke is the panel of doctors that we have. And not only that, the Memorial system's so big that they don't mind transferring their patients that need this type of medicine over to us. I've worked in many other hospitals where they don't do that.
And they're afraid of losing their patient, right?
Correct,
Yeah.
and which is
So
wrong.
bad. We're very wrong.
Yeah, that's why I believe what we're doing is amazing.
Well, because they also believe, doctors, we have
Correct.
to always believe that doctors are very good. Basically this is what they have to do for their patient. So tell me about somebody that came to you and now they're flying high. I'm sure there are a couple of people you could think of that are so thankful and went through the whole. I'm sure you have a lot of patients
Yes, I've
like
had
that.
some-
But
I've had some-
you don't have to tell us people's names, but tell us some circumstance or maybe which would make people understand what it was like when they first came in, and then what happened when
They didn't believe that their wound was going to any better.
What kind of a wound was it?
It was a diabetic wound.
And where
They've
was
had
that?
it for so many, on their foot, on their heel. They've had it for so long. They've been admitted to the hospital many times.
What does it look like?
The wound itself, oozing, smells bad.
They have what,
and
bandages on it?
Bandages all over. Can walk.
And
They can
pain.
walk.
These
a
kind of
lot
patients have pain.
Yeah. And they just don't believe it's ever going to get healed. So they go see the doctor, one of our specialists, and after that, after the 40 treatments of hyperbarics, they start doing maybe not even 40, 30 treatments. By the 30th treatment, they see change. They're happy. They feel much better. After the next 2 weeks, they're so happy. They always come back to say hello to us, and they don't even need to come to the hospital. And that's a feeling of like, wow, I really did something for this.
Yes, you're a hero. Thank you so much. I really appreciate both of you making the effort to come here. And we're going to give you a phone number again, 954-883-8014. Go and visit Tina and CESAR, and thank you all so much.
Thanks for having us.